An AI algorithm reads a screening mammogram and flags a lesion that 3 radiologists missed. 6 months later, it's confirmed. Early stage breast cancer, caught because of AI. This is already happening. And understanding how diagnostic AI works is now a Tier 2 competency. I'm Roupen, oncologist and founder of MeDucation AI. This is video 5, and we're entering Tier 2 territory, the intermediate skills. Today's topic maps directly to the AMA's Module 3, the use of AI in diagnosis. We're covering how AI analyzes medical images, interprets laboratory data, and processes clinical notes to support diagnostic reasoning, and critically, where it fails. Medical imaging is where diagnostic AI is most mature, and for good reason. Images are data-rich, pattern-heavy, and there aren't enough radiologists to read them all. The dominant technology here is the convolutional neural network, the CNN we covered in video 2. A CNN is a type of AI model that learns to recognize visual patterns directly from images, the same way it learns to tell a cat from a dog, except here it's learning to spot disease. These networks have been FDA cleared for specific diagnostic tasks. Radiology, AI algorithms detect pulmonary nodules on CT, identify fractures on X-rays, flag intracranial hemorrhage on head CTs, and triage urgent studies so the sickest patients get read first. Some can measure tumor response over time with precision that exceeds manual measurement. Pathology. Digital pathology with AI can analyze whole slide images, identifying mitotic figures, grading tumors, and detecting micrometastases that a pathologist reviewing thousands of slides might miss. Dermatology. AI classifies skin lesions with accuracy comparable to dermatologists in controlled studies, melanoma detection, basal cell carcinoma identification, and triaging concerning lesions for biopsy. Ophthalmology. Retinal imaging AI detects diabetic retinopathy and can screen patients in primary care settings without an ophthalmologist present. This was one of the first autonomous AI systems approved by the FDA. But here's where it gets interesting. Every one of these systems has a specific narrow scope. The AI that detects diabetic retinopathy cannot detect glaucoma. The AI that finds lung nodules doesn't assess for pneumonia. These are narrow AI tools, exceptionally good at one specific task and completely useless outside the data they were trained on. Your Tier 2 competency is knowing the scope and the limitations of each tool you encounter. Imaging gets the headlines, but AI in laboratory medicine and genomics is where the next wave is building. AI algorithms now help interpret complex lab panels, identifying patterns across multiple markers that suggest a diagnosis. Think of an algorithm that looks at a complete blood count, a reticulocyte count, the peripheral smear, and iron studies all at the same time to generate a probability-ranked differential for a patient's anemia. In genomics, the study of a patient's genes, AI, is transforming how we interpret next-generation sequencing data. That's the high-throughput technology that reads out millions of pieces of DNA at once. Variant classification, deciding whether a genetic mutation is pathogenic, benign, or of uncertain significance, is being assisted by AI models trained on thousands of known variants and their clinical outcomes. In my field, oncology, this is particularly relevant. AI helps identify actionable mutations, the ones we actually have a drug for, predict response to targeted therapies, and flag patients for clinical trials based on their molecular profile. But the Tier 2 skill here isn't just knowing these tools exist. It's understanding explainability. Explainability is the AI's ability to show you why it reached a conclusion, not just hand you the conclusion. When an AI flags a variant as likely pathogenic, you need to understand what evidence it's weighting. Is it based on how often the variant shows up in the healthy population, on functional laboratory studies, or on a computational prediction? The explainability output tells you this if you know how to read it. And that matters because you'll be making treatment decisions based on these interpretations. A patient's cancer treatment might change depending on whether an AI classifies a variant as pathogenic, or as a variant of uncertain significance, what we call a VUS. You need to understand the reasoning, not just the label. The third diagnostic application, and arguably the most disruptive, is AI that reads clinical notes. This relies on natural language processing, or NLP. Natural language processing is the branch of AI that lets a computer read, interpret, and pull meaning out of ordinary human language the way it's actually written in a clinical note, with all the abbreviations and shorthand we use. An NLP-based diagnostic tool can process a patient's entire medical record, years of notes, imaging reports, lab results, medication lists, and it can identify diagnostic patterns that span across visits and across specialties. Here's a clinical example. A patient has been seeing 5 different specialists over 2 years. Each specialist documented their own findings. An NLP algorithm reads all of these notes and recognizes that the combination of findings taken together points to a rare diagnosis that no single specialist considered because none of them had the full picture. This is powerful, and it's exactly the kind of tool where your Tier 2 skills become critical. You need to evaluate the AI's reasoning. When a clinical decision support tool suggests a diagnosis, ask, what data did it use? What did it weigh most heavily? How confident is it? And what's the range around that confidence? Is this a simple pattern match or a genuinely new inference? You also need to understand alert fatigue. Diagnostic AI that flags too many low probability possibilities just becomes noise. Studies show that clinicians start ignoring AI alerts after repeated false alarms. The systems that work best are the ones tuned to keep false alarms low while still catching the real cases, and understanding that trade-off is a core Tier 2 skill. AI in diagnosis spans imaging, labs, genomics, and clinical documentation. Each domain has FDA-cleared tools in active clinical use. Your job is to understand what each tool can and cannot do, how to interpret its outputs, and when to trust versus override its recommendations. That's the evaluative expertise the AMA's Tier 2 framework requires. Next video, we're tackling the most important and uncomfortable topic in AI, bias. Video 6 covers how AI bias shows up in medicine, how to detect it, and what to do about it. If you care about health equity, and you should, don't skip it.